Hematology stains. Non-vital or dead cell polychrome stain, also known as Romanowski stain, is widely used in routine peripheral blood smears. Most commonly used routine peripheral blood smear stain is Wright stain. Wright stain contains methylene blue, a basic dye which stains acidic cellular components like DNA and RNA blue, and eosin, an acidic dye, which stains basic components such as hemoglobin and eosinophilic cytoplasmic granules red-orange. Methanol fixative is used in the staining process to fix the cells to the slide. Staining does not begin until a phosphate buffer with a pH between 6.4 and 6.8 is added. There are several causes for red blood cells appearing two red and white blood cell nuclei being poorly stained. These include buffer or stain below pH 6.4, excess buffer, decreased staining time, increased washing time, thin smear, and expired stains. On the other hand, red blood cells and white blood cell nuclei appearing too blue can be due to buffer or stain above pH 6.8, too little buffer, increased staining time, poor washing, thick smear, increased protein, or a heparinized blood sample. Examples of polychrome stains include Wright, Giemsa, Leishman, Jenner, May-Grunwald, and various combinations of them. Non-vital monochrome stain is used to stain specific cellular components. Prussian blue stain is an example. It contains potassium ferrocyanide, hydrochloric acid, and a saffron encounter stain. This stain is used to visualize iron granules in red blood cells, known as siderotic iron granules, as well as in histiocytes and urine epithelial cells. Supravital or living cell monochrome stain is used to stain specific cellular components. No fixatives are used in the staining process. Examples include new methylene blue, which is used to precipitate RNA in reticulocytes and measure bone marrow erythropoiesis. Neutral red with brilliant crescel green as a counterstain is used to visualize Heinz bodies. Clinical disorders associated with Heinz bodies include glucose 6-phosphate dehydrogenase deficiency and other unstable hemoglobin disorders. All right, let's dive into hematopoiesis. Hematopoiesis is the process involving the production and differentiation of blood cells. Blood cell production, maturation, and death occur in organs of the reticuloendothelial system, often abbreviated as RES. The RS includes several key organs such as the bone marrow, spleen, liver, thymus, and lymph nodes. These organs play crucial roles in hematopoiesis, phagocytosis, and immune defense. Intrauterine hematopoiesis includes 3 phases. The mesoblastic or yolk sac phase begins at about 19 days of gestation. The yolk sac is located outside the developing embryo. The first cell to be produced is a primitive nucleated erythroblast. This cell produces embryonic hemoglobins, Portland, Gower-1, and Gower-2. Alpha-globin chain production begins at this phase and continues throughout life. The hepatic or liver phase begins at 6 weeks of gestation, with the production of mainly red blood cells, but also granulocytes, monocytes, and megakaryocytes. Alpha and gamma globin chain production predominates, forming hemoglobin F. Detectable hemoglobin A and Ag are also present. The myeloid or medullary phase begins around the 5th month of gestation, with the bone marrow producing mainly granulocytes. The myeloid to erythroid ratio approaches the adult level of 3:1. Alpha and gamma globin chain production predominates at birth, forming hemoglobin F, while hemoglobin A and A are also present. Pediatric and adult hematopoiesis undergo significant changes. By 6 months of age, the gamma-beta globin chain switch is complete. At birth, the bone marrow is very cellular with mainly red marrow, indicating very active blood cell production. Red marrow is gradually replaced by inactive yellow marrow composed of fat. Under physiological stress, yellow marrow may revert to active red marrow. Bone marrow characteristics change throughout life. In newborns, 80 to 90% of bone marrow is active red marrow. In young adults around age 20, 60% of bone marrow is active. Hematopoiesis is confined to the proximal ends of large flat bones, pelvis, and sternum. In older adults around age 55, 40% of bone marrow is active, and 60% is fat. Normocellular marrow has 30 to 70% hematopoietic cells. Cellularity is the ratio of marrow cells to fat, or red marrow to yellow marrow, and is described in adults as hypercellular or hyperplastic marrow has more than 70% hematopoietic cells. Hypocellular or hypoplastic marrow has less than 30% hematopoietic cells. Aplastic marrow has few or no hematopoietic cells. The stem cell theory explains the development of different blood cells. The myeloid to erythroid ratio is the ratio of granulocytes and their precursors to nucleated erythroid precursors. A normal ratio is between 3:1 and 4:1. Granulocytes are more numerous because of their short survival of 1 to 2 days, compared to erythrocytes with a 120-day lifespan. Lymphocytes and monocytes are excluded from the myeloid to erythroid ratio. Leukocytes are classified as phagocytes, such as granulocytes and monocytes, or immunocytes, like lymphocytes, plasma cells, and monocytes. B and T lymphocytes enter the blood and populate secondary lymphoid tissue, where antigen contact occurs. The white blood cell reference range, in SI units, is 4 to 11 times 10 to the 9th per liter. In conventional units, it is 4 to 11 times 10 to the 3rd per microliter. This range includes lymph nodes, spleen, and gut-associated tissue such as Peyer's patches. Granulocytes include neutrophils, eosinophils, and basophils. Antigen-dependent lymphopoiesis depends on antigenic stimulation of T and B lymphocytes. Neutrophils are the first to reach the tissues and phagocytize or destroy bacteria. In the process, they die. Monocytes differentiate into macrophages, and as such, they work in the tissues to phagocytize foreign bodies. They arrive at the site of inflammation after neutrophils and do not die in the process. T lymphocytes provide cellular immunity. They represent 80% of lymphocytes in the blood. When activated, they proliferate and produce cytokines and interleukins. B lymphocytes develop into plasma cells in the tissue and produce antibodies needed for humoral immunity. B lymphocytes represent 20% of the lymphocytes in the blood. Natural killer, or NK, lymphocytes destroy tumor cells and cells infected with viruses. They are also known as large granular lymphocytes. Eosinophils modulate the allergic response caused by basophil degranulation. Basophils mediate immediate hypersensitivity reactions, which are type 1 reactions. CD markers are surface proteins expressed by specific cell lines at different maturation stages. As a cell matures, some markers vanish and new ones appear.